Dr. Jose Alejandro has been a member of the Case Management Society of America since 2006. Over the last decade, he has taken on leadership roles in the Dallas-Fort Worth chapter of CMSA. He has served as chapter president and has served 5 terms on the CMSA National Board, including chapter president's council rep, 2 terms as treasurer, president-elect, and is concluding his 2-year term as national president. Jose was awarded CMSA's Case Manager of the Year in 2015. In 2012, he received the Case Manager of the Year award from the DFW chapter. Jose began his nursing career as a licensed vocational nurse in the military. His academic pursuits continued by earning a bachelor's, 2 master's, and a doctoral degree. He currently serves as a lieutenant colonel in the Army Reserves. Jose currently wears many hats. As Director of Care Management for the University of California, Irvine Health, Dr. Alejandro has oversight of case management, utilization management, clinical documentation improvement program, clinical social work, and the Preferred Provider Network. As an educator and professor for Mount St. Mary's University in Los Angeles and visiting professor for the University of San Francisco, he has teaching responsibilities in the associate's, baccalaureate, master's, and doctoral programs. When asked why he became involved in case management, he simply said, "To make a larger difference in the lives of others." He further notes that as case management professionals, we have a unique opportunity to teach and mentor others in regard to the importance of healthcare across the continuum. In addition to volunteering with CMSA, Jose's resume showcases involvement with several organizations, both at the national and local levels. He serves as the treasurer for Sigma Theta Tau International, as president for the Organization for Associate Degree Nursing Foundation, and on the board of directors for the American Academy of Nursing. He was also awarded fellowship for his case management contributions by the American Academy of Nursing. Jose is active and proud of his work with the National Association of Hispanic Nurses and served as their 15th president from 2012 to 2014. As CMSA's national president, Jose has enjoyed presenting to the CMSA chapters. It is his hope that his message will help inspire case managers to become active change agents within a transforming healthcare delivery system. Jose freely shares his passion specific to systems thinking and improving access to care for vulnerable and at-risk populations. On a personal note, Jose loves watching professional sports and traveling internationally. He enjoys sharing time with and spoiling his 3 grandchildren. He is the youngest of 13 children, raised in a bilingual family in a small oil industry community in South Texas. He was the first of his siblings to attend and graduate from college. 2020 has been especially rough for Jose and his family. In January, Jose lost his best friend and father, Jose Pepe Perez. His love of friends, family, and his community has driven his goal of supporting professional case managers in their quest to ensure exceptional care for the individuals that we serve. Please welcome your CMSA National President, Dr. Jose Alejandro.
You know, it's always difficult to see yourself on the screen, but I have truly enjoyed serving as your CMSA president over the past 2 years. I want to take this opportunity to welcome all the attendees who are coming from throughout the country and also presenting from throughout the world. I'm super excited for all of the events that are occurring. I'm also super excited to see the recipients of the multiple awards that we have this year. I'm also excited to know that we will have the opportunity to recognize outgoing board members and also incoming board members at different times throughout the conference. I want to take this time to kind of highlight my 2 years as president, I think when we look at this, we look at it from a different perspective. I was very fortunate to be a president of other national associations before becoming president of CMSA. So I was super pleased by the membership of being selected to be the president for this time period. When I reflect back at the things that have occurred, so many things have happened over the past 6 months that have impacted the way we think, the way we act, and most importantly, the way we react to others. So first of all, I want to go over a few things related to the conference, and then I want to go into what is on my mind related to reflecting over the past year and also reflecting over the past 2 years as your CMSA president. So regarding the conference, if there's any help needed with navigation, that could be found in the virtual lobby. We have staff that's available to you, so please reach out if there are any problems, and we'll be more than glad to try to assist you. Again, we've gone from the brick and mortar conference to a virtual/hybrid model, so we have several staff members that are available to you. Be sure to attend the live sessions, the networking, the roundtables, and the 30th anniversary party. One of the things that I keep coming back every year for CMSA is the fact that I'm able to network with colleagues from around the country. I'm also amazed at the number of first-time attendees, and trying to be inclusive of them is critical so that we have connectivity between our members throughout the country. I still remember my first year and being the first time I attended on my own, and so I was so glad when people came up to me and introduced themselves, and we've been friends ever since. Can't attend everything. Most sessions will be on demand through July 11th, so a great opportunity to catch up on the sessions that you were not able to attend during the assigned period. So again, all our sessions will be on demand. Most of our sessions will be on demand throughout July 11th. Be sure to visit our sponsors and exhibitors in the virtual exhibit hall. Show and share your appreciation for their support. Our conference event cannot happen without them, and so they are critical to the success of any conference, and they're also critical to the success of the association. So please attend any events that highlight our sponsors and exhibitors, because without them, we cannot put out the conference. So at this time, I want to kind of reflect on the 2019-2020 review. So as we talked about in the annual meeting, we talked about the fact that Kathy Fraser and myself, the CMSA Executive Director, and myself as CMSA President, we traveled quite a bit to the different chapters. The chapters are our lifeline to the organization, and so we need to partner as a national organization with their chapters so that we can increase memberships, offer opportunities for networking, engage our communities, and most importantly, set the standards for the case management industry. So over the past year, we've had the opportunity to literally go cross-country on multiple sites. I can tell you about a particular week where I was in 5 cities in 1 week. I didn't know where I was waking up in the morning, but I did have a phone, so I would call down to the desk and say, what city am I in? So I think sometimes we have to reflect that it's all about the outcomes that we're looking for, and engaging our chapters is one of the most critical things that we can do as an organization. So as CMSA president, I was able to travel with some of the FI staff to the CCMC symposium. And this was right before we ended up not having as much travel. And so you could start seeing the changes that were occurring around the country. Restaurants were closed, staffing was downsized a little bit, people were being furloughed. So we have to understand that this takes time to recover as a nation, as an association, and most importantly, as a community. So please feel free to reach out to any of your colleagues throughout the country for support, for questions, for any information that can assist you in delivering good case management, and also to help you with your own family. So one of the things that we have to recognize as an organization is the COVID impact. I didn't share this in the other sessions because I wanted to bring it up during this time. So I tell people that I'm a COVID survivor. My spouse is also a COVID survivor. So I have to reflect on what we went through during that time frame. So when I look at this, it was probably beginning of April. Charlie was not feeling well, so I had just left for the Army Reserves and I went to Georgia to support the Georgia National Guard. And so he called and said, I'm not feeling well, so my stomach really hurts. And he goes, I'm going to the emergency room. Now, mind you, Charlie is probably the one person that does not want to go to any emergency rooms, does not ever want to be admitted. He had actually told me at one time that he had never actually been a patient inpatient. And so it's hard to believe that we're complete opposites. I may hurt my hand and I'm the first one in the emergency room, so I could be a hypochondriac. So, but compared to Charlie, it's been it's a different route that we went through. So I was in Georgia. He was admitted. He had a ruptured appendix. As part of the process, they tested him and he was COVID positive. So he was isolated. And so one of the things that we talked about as a nation was we need to be socially isolating from others. But what happened for Charlie is that he was isolated socially. You know, people didn't want to come into his room. People would talk to him from the door. So these are some of the things that we have to look at as a nation as we look to move forward. I returned from my 4-day weekend with the reserves, and I was feeling fine during travel. He'd already been in the hospital 4 days. I went to actually I got home, and the next day I didn't feel bad, but I didn't feel well either, and so I decided to remote. And the following day, I just felt like my insides were cooking. So I took my temperature, and lo and behold, my temperature was 104. And so the next thing I did, because I'm an asthmatic, was went straight to the emergency room. And so I was very fortunate. I was told to recover at home. My asthma was not triggered. But for Charlie, his 11-day ordeal became 11 days. So we didn't have a surgeon that thought that he needed to be operated on. Finally, one of the trauma surgeons said, oh, no, we need to take him in. So he did have his surgery. And he had a hard recovery versus me, who did not have a hard recovery. I think for me, my COVID recovery was more about not having the energy to do anything. For example, taking a shower and even just shaving. I would sleep 20 hours afterwards, to whereas Charlie was inpatient and was spiking fevers throughout the day, was not feeling well. And so in the end, we can actually say we're COVID survivors. We were very fortunate that Charlie did not go into the critical care area. He did not require any ventilation, things like that. And also, from my perspective, was the impact of not being having my asthma triggered and or any other respiratory issues. Granted, we talked about at the last year's conference, and I presented with a couple of physicians that I should probably be on some biologics. I'm actually in the process of doing that because if anything before COVID didn't scare me, COVID did. We have to recognize that this is a new normal. And so what are some of the things that I learned about from being COVID positive? So for me and Charlie, we both went through social isolation. We feared going back to work. We feared of not being accepted. So those are the kind of things that we have to think about. And we also have to think about being careful with how we call COVID. So COVID is not a Chinese disease. It is not a Chinese virus. So we have to be very careful that we're not stereotyping anything that's occurring. We have to recognize that in China, this is where it happened. For whatever reasons, it occurred, and then it went globally, and it became a pandemic. So at the end of the day, we need to work with each other so that we provide good case management and recognize that we need to be impartial and create an environment that people can operate in. So I'm going to move over to the new normal. So as the new normal occurs, we have gone through many changes. I mean, I think we look at the sporting events. Everything has been canceled, from the NBA to the baseball to hockey. All the things that we're used to have changed. Having restaurants closed, having to wear masks. And I live in California, so we went from being completely shut down early stage, and so we benefited from that. We also started opening, and so as a result, we've seen the numbers climb. So our governor just recently announced that we're back to universal masking. Our hospital was very diligent, and we didn't have as many patients early on. Now we've seen a high increase of patients in our critical care and also in our regular beds. And so when I look at what do we think about the new normal is everyone has to change. Whether we want it or not, academia has changed. We went from brick and mortar to online. You have people that have never taught online having to adapt. And so when I think about that, that's happened everywhere. You know, regardless of your trade, you have changed. For example, we've changed the way we do case management in the inpatient world. Most of the people that worked in buildings have gone to being remote. Is that the wave of the future? Only time will tell. So we have to remember that this occurs and we have to be able to adapt. And so one of the things that it was very strange for me was to go, and yes, I need glasses. I don't have them on today. Was the fact that I needed to get glasses. And so I had gotten the prescription right before COVID hit, and I haven't been able to fill it, but I was able to fill it last week. Well, they checked my temperature. I had to wear a mask the entire time. And so they only allowed about 5 people in the facility. So think about it from a more global perspective. How does that impact our economy? How does that impact our pocketbook? And so it's important to know that we are going through a global change on how we operate within our communities. And so it'll be interesting over the next 6 months how we recover and or engage a second wave as it's being predicted. I want to take a turn on the discussion today and really address the things that are occurring. One of the things that we saw loud and clear is that we saw a new push, not only nationally but internationally, on racism and social justice. You know, the things that happened with multiple members of our African American community with police brutality has become a national pandemic, epidemic. You know, I'm not sure what to call it at this point, but I think our communities have woken up. I think it's important to know that it's not okay, and we need to be more inclusive and have more diversity. So I was super supportive of when CMSA put out their statement on the support for our communities. And this includes all diverse communities. But we have to also recognize that our African American communities have been hit hard from a police brutality, racism. And so we have to also recognize that at one time in our country, we were all labeled as either Black or white. So I consider myself Hispanic. I've been Hispanic my entire life. But if you looked at my birth certificate, it still says white. So have we changed in all that time, and have we really recognized that we can't look at ourselves as Black and white, and we need to look at ourselves as being diverse? So super excited to see multiple organizations put out statements on the diversity, inclusivity. I think also there has to be a lot of education. One of the things that I've charged the Case Management Society of America Board of Directors is that we need to have action items in support of our standards of practice and also our strategic plan. So I've had discussions with our incoming president, so it's a great opportunity to move CMSA in that direction so that we are part of the solution. And so as more and more organizations are willing to partner, I think this will be a great opportunity for us to partner with other organizations in the case management community, but also outside of that. As we move over to the social determinants of health, we have to recognize that we have a very diverse practice within CMSA. We have social workers, we have nurses, we have all of those individuals from other practices. We have rehab counselors, we have rehab people. So it's important to recognize that the diversity in itself provides a great opportunity to provide more services, more succinct services that will help our case management community. So from that end, we must continue to partner with others because we can't solve all the issues. And so as we continue to partner with other organizations, we have to recognize that the voice of many is a lot louder than the voice of one. So even though we may be a strong organization, our voice is stronger in partnerships. So I think at the end of the day, this gives us a great opportunity for us to work with other organizations that have a similar mission and vision, and how do we improve all communities from a social determinants of health. You know, the environment, the access to care, the support, the community support, those are all critical aspects of how we engage our communities and how do we deliver a high quality product from a case management standpoint so that we have people getting care at the appropriate time. If we go to the different levels of prevention, primary, secondary, tertiary, it all comes down to education, identifying a disease, and most importantly, preserving quality of life. So as CMSA, we have a great opportunity to ensure that we are part of the solution. And in closing, I pretty much want to just thank all of my family and friends, from Charlie, Jesse, Sonia, Angie, Ellen, all of my friends that have supported me. My family members are huge. I have to think about the loss of my father, who was and will always be my best friend. At 90 years old, he did succumb to hospice and really wanting to give up on life. But as he stated, I lived a good quality life. I have 13 kids. And sometimes we tend to fight, and we do. But we always say once somebody brings up on one of us, we circle the wagons. But, you know, it was very difficult. And I'm very thankful for Kathy Fraser, for the FI staff, and also the CMSA Board of Directors, who supported me in my time of need, because I did lose my best friend, as he was someone I spoke to on a daily basis. And if I didn't call him by 6 a.m., he was already calling me. So again, make sure that you communicate with your family, your loved ones, and always ensure that you are on good footing with all of them, because you don't know when they're going to be gone. So again, thank you for the opportunity to serve as your CMSA president for the last 2 years. If there's any questions, you can email us at cmsa@cmsa.org. And thank you for attending this year's conference.